We were the first to tell you about a hospital technician under investigation for spreading the hepatitis C virus to patients. ABC 15's Tim Vetcher learned when and where that tech worked here in the Valley and what's being done to alert those who may have been exposed.
For nearly 4 months in 2009, David Kwiatkowski worked at the Maryvale Hospital as a technician. For 11 days in 2010, he worked at the Arizona Heart Hospital in the same capacity. 2 years later, investigators want to know if Kwiatkowski infected the patients he came in contact with at these two hospitals with hepatitis C.
We don't actually know what he was doing while he was here in Arizona hospitals.
Investigators say while working at hospitals in New Hampshire, Kwiatkowski injected himself with pain medication meant for patients. But instead of discarding the syringes, investigators claim Kwiatkowski put the needles back for use on patients, thus infecting them with hepatitis C. Right now, spokespersons for both hospitals say there's no evidence Kwiatkowski even had hepatitis C during his stay here in the Valley, but they do want to test patients who may have come in contact with him for the hep C virus nonetheless.
We are not aware of any patients that have come forward with hepatitis C.
If someone did become infected with hepatitis C, health officials say they would have possibly developed symptoms in those first 2 months after exposure, but the majority of patients will never develop symptoms and therefore can unknowingly spread the virus.
That's why it's so important that if you're exposed to hepatitis C, you get a test.
The hospitals plan to offer free testing to patients to determine if they have hepatitis C. First, though, they need to identify those who had contact with Kwiatkowski. Once that happens, patients can expect to receive a certified letter from the hospital in the coming weeks. I'm Tim Vetcher, ABC 15.